Hello, I'm Dr. Dawn Harper and I'm delighted to be back here with Stay Sure Wellbeing, talking today about face masks because the rules have changed. So we know that there is very little evidence that wearing a face mask as a member of the general population will be of much use. And in fact, it's important to remember that when we're out and about, are wearing face masks, it's to protect other people from ourselves rather than for our own protection. So a face mask that is worn when you're out in the street is really there in case you should be shedding virus. And we think that people are capable of shedding virus a couple of days before they're symptomatic. Now, of course, if you've got a cough, you should be isolating and you shouldn't be out and about. But you could be incubating the infection and potentially be able to spread it onto other people. So we are now saying that as in England anyway, the lockdown is starting to ease, we are expecting some areas perhaps to be busier, and I think the most likely places where it may not be possible to socially distance might be on public transport, it may be in some shops, and so we are suggesting that as people are going back to work and people will be out and about more, that if you're in any environment where you think you may not be able to guarantee a 2-metre social distance, that actually it would be a good idea to wear a mask to protect other people around you. So that would be, as I say, public transport, certain shops. Certainly if you go to your GP surgery, many of you I know will already know that you'll have to telephone first, but if you are invited into the surgery, you will be asked to put on a mask when you come through to see us in surgery. So, should you be buying a face mask or making one? There are lots of great YouTube videos around telling you how to make your own face mask, and of course you can buy them. They are not surgical grade, the sort of face masks that we are asking the general public to wear when they are in positions where they may not be able to socially distance. So how should you wear your face mask and how often should you clean it? Well, you need to have your face mask covering your nose and mouth. It's important that both areas are completely covered by the face mask whenever you are in any area where you may not be able to maintain social distancing. And you need to put the mask on before you go out and keep it on until you have finished that trip. It's important you try not to touch the mask. And when you're ready to take the mask off, you should wash your hands or sanitize them, and then remove the mask by the ties or the loops that go over the ears and either dispose of the mask if it is a disposable mask, or if it's a homemade fabric mask, it needs to be washed after every use, and I'll come back to that in a moment. Once you've removed the mask, you then wash your hands again. Washing your face mask, well, it's important that a face mask is washed after every use. So it may well be, if you're making your own, that you should perhaps make 2 or 3 so that you can always have a clean face mask ready for whenever you may need it. And you should wash this in an ordinary washing machine, or you can hand wash it on a reasonably high temperature, and preferably tumble dry it on a hot temperature so that you know it's completely clean before you use it again. We do know that if face masks become wet, they are less effective, and if you are breathing moist air in and out for a long time in a face mask, it will become damp, and at that point it is less effective. So important that you remove your face mask, as I've described, and make sure that you clean it before its next use. And what are the differences between surgical face masks and the kind of face masks that I'm suggesting that you use? Well, a surgical face mask is a highly regulated piece of equipment that is designed not just to prevent me from transmitting the virus, but also to protect me if I'm dealing with patients who have suspected or confirmed coronavirus and I know that I'm being exposed to viral shed potentially. So they are a different grade, the surgical masks that we use in clinical settings, and they have to be very tightly regulated. and they come in different forms, but the paper mask is the one that you'll often see people wearing in theatre settings and so on. The general masks, those are a once-use disposable mask. We have some other which we use for more specialised PPE when we're dealing with what we call aerolizing procedures, perhaps if we had to intubate somebody, or we're needing to resuscitate somebody who we think or know has coronavirus, and those have filters which can be replaced. The homemade masks are often made from material. There's some great, almost like fashion statements going out there now. So I suspect that as things go forward, as Wales, Scotland and hopefully Northern Ireland feel able to follow suit in starting to ease lockdown, and as long as we keep control of this virus, and as long as that R number that you keep hearing about doesn't go above 1, which would mean that our curve could start going up again, as long as these very slight lifting of the restrictions is working, then I suspect we may find that the amount of time that we need to wear a face mask outside of our home may well increase.